Thank you, Yuli. I'm very excited to be here. Thank you for coming. We're Claimly, and we help with the reimbursement side in healthcare in this country. So our vision is to make healthcare possible. Who here runs a private practice? One? There is someone else? Just one? Okay. Who here coming from a medical device company, they built great system or medical devices, but the reimbursement side is really hard? From which company?
It's a medical device that uses it's an infusion system. I won't go into big detail, but it's difficult to get through the reimbursement.
Okay. Which therapeutic area?
Excuse me?
What therapeutic area you're focused on, like internal medicine or?
It would be in ER.
ER, okay. Someone else from the medical device world? Okay. So we help with the reimbursement side, and I would love to show you examples. So I will maybe start with my background. So I'm originally from Israel, as you can tell from my accent. A medical doctor by training. I practiced dermatology and venereology, STDs, for 3 years. Then the hospital where I worked faced a big financial crisis and incurred debt of $500 million. And that's what really made me think about the healthcare cost, how it's important not just to deliver good care, but also the financial side is super important. And then I decided to get some business knowledge and experience and started to look in health. Okay, so we can do it without a presentation. So getting back to my story, I started to look into MBA programs, and I did the full-time MBA program at MIT in Boston. During the summer, I worked for the Brigham and Women's Hospital. And my co-founder is Aviv. He's a software engineer from Israel. He was one of the first employees at Snapdo that was acquired by Facebook. Then Aviv worked at Facebook, Groupon, and Clover Network. So that's a little bit about our experience. I don't have the slides to show you, but I will just describe you a use case from everyday private practice. So what private practice do you run, if I may ask?
It's with my wife. It's psychiatry.
Psychiatry.
Yeah.
Perfect example.
Yeah.
That's exactly like our focus, the mental health.
But we don't take insurance.
Yeah, that's perfect. That's perfect. Okay, so I will describe you how it works. Can you please repeat your name?
Oh, my name's Yener.
Yener, okay.
Right.
So I will describe you like a typical a conversation with a new patient. So let's say you want to start a therapy. You call Yener clinic and you want to start seeing him on a weekly basis. And then you ask him how much it costs to see you. How much does it cost to see you for a psychotherapy session once a week? 60 minutes, how much it costs?
So it's a master's level therapist, which is my wife that's doing it, and at this time it's $150 for 45 minutes.
Okay, and then I tell you, okay, $150, but I have insurance, I have Aetna. How you can help me? You don't take insurance.
That's right.
But I have a great insurance. I'm paying $800 a month. What you tell me?
Right. At this time, we don't take insurance.
Okay. So you can tell to your patient, well, I don't take insurance. You have to pay me on a weekly basis $150. And then I said, wow, this is $600 per month. This is very expensive for me. And then, so with us, let's say could be a deal breaker for a patient. $600, repetitive expense, it's a deal breaker. What Claimly does, with Claimly, you will tell your patient, well, I don't take insurance, but I use Claimly. And with Claimly, you can reduce your bill immediately. So instead of paying $150 per session, you might pay $50 per session. How come? we immediately reimburse the patient, your patient. So patient will pay $50. We are advancing $100 to you, so you get your full fee. No one does the medical billing, we do it. Like, your patient don't need to deal with insurance. You also don't have to hire medical billers when you know it's very expensive. And no one takes the risk of not being reimbursed. So that's how we work. And then later, after we advance the money to the clinic, we take the claim, file it to insurance, and get not $100, but probably $110, $120. So we're a fintech company in healthcare. I know it's a kind of a unique animal, but that's what we do. And our solution basically help physicians and therapists to fill up their clinic, because when people pay less, they come more. And then the second thing that we're helping with is the administrative cost. Like, we lower the administrative cost. You don't have to deal with medical billing. And then the last thing that we do is that we remove the risk from your clinic. You don't have to take the risk on yourself of not being reimbursed by insurance. So that's basically what we do. We currently focus on mental health, so working mostly with psychiatrists and psychologists. So that's basically what we do. Our goal now is mental health. Then our follow-on verticals are speech therapy, acupuncturists, chiropractors, and then later on dental and vision. And with that, I will open it up to questions, if you may have. Yes?
So can you explain to me a bit about the follow-up that you guys do with the insurance companies, and how exactly you get that $110 to $120 when insurance is not accepted?
Yeah, sure. So we use we have a very complicated algorithm that we built. We use a lot of data points that we take into our algorithm. That's our secret sauce. And we're running for more than a year now. And we have a very good risk management for mental health. So basically our historical data, that's what really enables us to predict well the estimated reimbursement from insurance.
What do you expect from the provider in terms of documentation?
So we provide to providers a very easy tool to generate very quickly the super bill. You just have to put the date of service. And at the beginning, when you onboard the patient, you give us the diagnosis, the address of the patient, so some general information, and then it's very easy to generate the super bills. You just put the date of service. And then we quickly create the super bill. You can email it to your patient, and we take the super bill. So it's really easy and frictionless. Yes?
What do you do in the case where the insurance company requires pre-authorization?
We also handle that.
Okay. What's the name of the company again?
Claimly.
How do you
Yes.
make money?
We're a fintech company. So we pay $100, we collect $110.
So the difference is yours.
Yeah.
And $50 is coming from the patient.
Yes, insurance would never cover, like the doctor here can share with you, will never cover his full fee, because otherwise you can charge $1,000. Insurance wouldn't cover that for out of network. Any more questions? Yes?
How often do you not get reimbursed?
So currently we fail in 5% of the cases. We get better as we go. At first we failed a lot. We still lose money, but our goal is to improve as we go.